Yesterday we told you about a new health team in Bedford which has reduced the numbers of elderly people being admitted to hospital by more than a third. They've done it simply by visiting care homes every week to monitor the health of residents.
Well, the essence is the old saying, prevention is better than cure. Today we report from a second award-winning project. This one is aimed at reaching people who might not normally turn up for health checks.
It's what I think in the business community they call lean management, is actually engaging frontline staff.
Well, I'm sorry, that's due to follow our report from that award-winning project. We'll see if we can get to that one before we hear from the Health Secretary, Andrew Lansley. We can see the report now.
So I'm going to do your health check.
We seem to be having problems. We will get the report first and then we will hear from Andrew Lansley.
Hopefully.
This time it's going to be.
So I'm going to do your health check today.
Yeah.
So I'll be doing your blood cholesterol, for
Yeah.
which I'll give you your results today.
Yeah.
Your blood glucose, your blood pressure, and then we'll discuss the results and we'll go from there. Is that okay?
It's a full MOT for those aged 40 to 74, and it's aimed at those hard-to-reach groups, everyone from carers to the homeless. Today they're with the Bangladeshi community.
They're really busy, so they're probably working, I don't know, night shift, or they don't have time to go to the doctor's. Whereas here, they could just, we advertise it and they could just come if they're free and available.
It's the people in these most deprived groups who carry the highest health risks.
We're not here to preach at any patient that comes along. It's about making them aware and really showing that we care about them. And actually, the GPs in North Bedford really do care. When there is times of cuts, this is wonderful. The fact that they're enhancing the service more than reducing it.
Mr. Mir has all the early warning signs.
Your LDL, which is your bad cholesterol, is 3.77, and we like it to be less than 3.
He'll be given advice on exercise and diet and further help.
We stream people to Weight Watchers, for example, and we have good evidence that the people we stream there through these programmes stay for longer than other people, lose more weight than other people, and as a consequence of that, it's reasonable for us to suggest that they're less likely to move forwards towards type 2 diabetes in the future.
Ultimately, they want people to help themselves, preventing their health becoming a heavier burden to both them and the NHS. Nikki Jenkins, BBC Look East in Bedford.
And we'd love to hear what you have to say about that story. You can contact us in the normal way, obviously on telephone, via email or via our Facebook page.
Well, as we've already seen, Andrew Lansley is the Health Secretary. And when I spoke to him late this afternoon, I started by asking about the work they're doing in Bedfordshire to keep people out of hospital.
It's what I think in the business community they call lean management, is actually engaging frontline staff in driving improvements. And I think what on Look East you've been showing from Bedfordshire is how frontline staff getting together in the clinical commissioning group have been designing new ways of delivering better care for their patients, and I think that's really commendable.
Of course, they have to do things like this because they need to save, across the service, £20 billion by 2014.
Well, over the course of 5 years, as you rightly say, we need to save money in the NHS in order to invest it for the benefit of patients. It's not that the NHS budget is being cut, and in Bedfordshire, next year the budget will go up by near £17 million. But that doesn't mean that's going to be enough to meet all the needs and the pressures and the demands that are on us in the NHS if we just carried on doing the same things in the same way.
Logically, if you push this forward, it will mean that we will need fewer hospitals.
It does have an impact on hospitals, and because we've got an ageing population, and age is the principal driver of health need, of course we've got underlying pressures. So actually what it means, I think, is if we manage our services better, we can respond to all that extra demand. It means in hospitals can be more focused, for example, on day case surgery or on diagnostic activity and treatments without necessarily having quite so many patients in beds to the extent that we used to have in the past. But the quality overall and the results we deliver for patients, that can improve.
So no more hospital closures and better service in the community?
I don't think it's about hospital closures at all. I think it's about reshaping the services we provide. There will be increased support for patients in the community, and that's right. There will be a change in the way things are done in hospitals, and there may be a change in where things are done, because sometimes it's important for patients to access specialist care at specialist centres. But overall, we should be constantly focused on what is in the best interest of patients and how we can deliver improving quality for patients. And I want us to be measured not on how many hospital beds we've got, but measured on what are the results we're achieving for patients.
Minister, thank you very much.
Thank you.